I'd like to demonstrate how I evaluate the supraspinatus tendon. As I move the patient in the CRAS modified position, hand on the hip, I'll scan superior along the humeral head at the level of the articular surface. As you can see here, we can identify that interval space as well, but we can also see the full width of the supraspinatus tendon, the anterior to posterior segment. Moving the elbow back and forth, pushing the elbow back, will bring that anterior segment out. This will flatten partial thickness tears, but open up a full thickness tear. Bringing the elbow towards you will open up a partial thickness tear, but it may hide a full thickness tear. So be careful when you're looking at that and you suspect a tear. I spend a lot of time scanning normal anatomy. As you can see here, this is normal because it helps me identify very small areas of pathology when I do a scan. Now, looking at the supraspinatus tendon, one of the things I like to focus on is splitting this tendon in half. So I split it in half. This is the anterior segment, this is a posterior segment, and then I do focus on the overlap or the conjoined tendon where the infra overlaps supra. This is very important to me because you can have isolated tears just within the segment that may not be affecting the posterior segment or the anterior segment as the tendon inserts on the greater tuberosity. Scanning that to the tuberosity here, it may reflect as normal. So when I do find a tear in either one of these segments in a short axis plane, I measure it this way, and then I also look at it in a long axis plane, but I turn onto that segment in a long axis plane. So it's important to say if there was an area here within the anterior segment, I'll take the transducer and turn long on that segment. If I have a hard time identifying which plane I turned into, then I always scan medially to the biceps tendon, tilt and move the probe laterally and scan lateral, and this first slice, and it's a subtle movement, is the anterior segment. If you toe heel the transducer or heel toe the transducer, this is a heel toe maneuver, it'll allow you to see the fibers at the level of the anatomical neck, and you can eliminate the anisotropy. If you toe heel the transducer, it allows you to see the musculotendinous junction here. So these could be areas where a non-displaced full thickness tear could hide, or partial thickness tears could hide in there as well. So one of the things I do is identify the biceps, identify that first slice that you come into being the anterior segment of the supraspinatus, scan a little more, you're in the posterior segment of the supraspinatus, scan a little more lateral, and tilt. Now we're definitely in the overlap. So the fibers that we see here now are infra. These are supra. A lot of people mistake this area for just supraspinatus, but the anatomical neck has flattened out. We are truly at the overlap. If I come out a little more lateral, then the anatomical neck is completely flat, and all of these fibers here are the infraspinatus fibers.